Well, good morning, everyone. Welcome. I'd like to introduce myself. I'm Paula Morrison. I am a practice lead for long-term care and seniors care for interior health. I'm grateful to be here, and I'd like to begin by acknowledging that interior health is situated on the traditional ancestral, unceded territory of the Silks Okanagan Nation, as well as bear with me and please, yeah, just bear with me because I'm not a fluent speaker of some days not English as well, but the Sokoteen Nation, the Dakildene Nation, the Swatnam Nation, the Ingla Kutna Nation, the Northern Schlatnium Nation, the Silks Nation, and the Tunaha Nation. I would also like to acknowledge that you may be joining us today from many places near and far, and may want to acknowledge or pause to acknowledge the traditional owners and caretakers of those lands. I'm actually Tahltan from northern BC and Irish Canadian descent, so I like to situate myself in knowing that and sharing that. And I'd like to welcome our guests. So we have from Nav-CARE, we have Gloria Puurveen, Kelli Sullivan, and Kelli Ashford. I appreciate you, all three of you, being here today. I can see you're a team, and you're a team from UBC Okanagan and the Nav-CARE project. So I'm excited to listen to your presentation and take that in. Becoming a compassionate community, lessons learned from 8 Canadian communities. I've like to welcome you and all our attendees to the 13th Annual Okanagan Embrace Aging Month, and I thank you for joining us today. Embrace Aging is co-hosted by Interior Health and the Institute for Healthy Living and Chronic Disease Prevention at UBC Okanagan. It was launched, this month of Embrace Aging was launched 13 years ago to celebrate and raise awareness about positive aging, and has once again there's a number of educational opportunities and events organized during the month of March, and there are a number still happening. The beauty of them is that there's so many resources in the community and events that you can take in that are free, and they're designed for everyone, young and old alike, and focus on a variety of topics related to healthy aging and ways to improve quality of life among seniors and their caregivers. Our goal is to inspire everyone to embrace positive aging. I have a little housekeeping piece, and that's that closed captioning. To turn closed captioning off, you can select the hide caption button on the menu bar or turn it on. Questions. You can type questions or comments for the speakers into the chat box during the presentation, and questions will be read at the end of the presentation and with the help of Kelli, which is great. And feedback for this event, please complete the survey that will be emailed to you. Today's event is brought to you with support of Embrace Aging, and I'm going to hand the mic over to Gloria, who will start the presentation. So thank you.
Thank you so much, Paula, for that introduction, and thanks to all of you for taking the time to participate in this webinar. My name is Gloria, and today we'll be talking about 2 projects that center on developing compassionate communities. Kelli Sullivan will lead us off first to talk about what grounds the 2 projects. Then she'll give details about the project she's leading, the Compassionate Communities Volunteer Navigation Project, or the CCVN. We're going to throw out some acronyms for you, which you're really going to love. Once Kelli's gone through those details, I'll hop on and talk about the Compassionate Dementia Inclusive Communities Project. And this will be followed by both of us highlighting some of the lessons learned thus far. Then we'll have some time for questions, and at the end, and Kelli Ashford will be monitoring questions in the chat. So feel free to ask questions throughout the session. So without further ado, take it away, Kelli.
Thank you, Gloria. Yes, we have acronyms and we have two Kellys just to keep everybody on their toes. My sense is many of you probably already understand compassionate communities and what that movement is about, but just so that we're all starting with that same understanding. Compassionate community is made up of people who care deeply about improving the experiences of those living with serious illness or life-limiting illness, as well as those who are caregiving, dying, or grieving. So it's all about community members stepping forward. So reaching out, connecting, supporting individuals and families so no one feels alone. Together, they raise awareness, they build networks of care that help people feel seen, supported, and empowered. So the compassionate communities approach that we're drawing from comes out of the work of the BC Centre for Palliative Care, particularly their Compassionate Communities Toolkit. It really shapes how we think about communities showing up for people who are facing serious illness, caregiving, and loss. And I think Kelli Ashford may be putting the link to the Compassionate Communities Toolkit in the chat. Thank you, Kelli. Another important piece of this work is volunteer navigation, and that's where Nav-CARE comes in. So Nav-CARE, for those of you that don't know, is a well-established evidence-based program that focuses on recruiting, training, and supporting volunteers to do the kind of relational community-based work that we're describing here. So Nav-CARE stands for navigation, connecting, advocating, resourcing, and engaging. And in practice, that means trained and mentored volunteers walking alongside people whose health is declining and their families. So really helping them stay connected and supported with the aim of improving their quality of life and enabling them to age in place, whether that would be at home or in a home-like setting. Traditionally, Nav-CARE has been delivered through hospice palliative care associations, but what's exciting for us is that we've been expanding this work through partnerships with health authorities, as well as other community-based support services for older adults. So as Gloria mentioned, today we're going to talk to you about two projects. One is a 4-year project funded by the Canadian Institutes of Health Research, and the other is a 3-year project funded by Health Canada. Both projects bring together compassionate communities and Nav-CARE volunteer navigation to strengthen our ability to care for older persons living with declining health and to support their care partners as well. In addition, the Health Canada project adds another important layer by focusing on dementia-inclusive communities. So this part of the work is about reducing stigma, raising awareness, and creating practical, empowering supports so people living with dementia can continue to age in place, connected to their communities. And that's the project that Gloria will be talking about. So an interorganizational approach. As we walk you through these two projects, you will see that what really brings this work to life is collaboration. So community organizations working together towards a shared vision. By partnering this way, we're able to reach more people and offer meaningful support during some of life's most challenging moments, whether that's serious illness, caregiving, end of life, grief. And at the same time, we're building awareness and strengthening a more compassionate, community-driven approach to care, particularly for people living with declining health and dementia. So how do communities implement this approach? So next slide, Gloria, thank you. I'm not sure if you can see the particulars in the diagram, but I will walk you through them. So to guide this work and these two projects that we're talking about today, we drafted a 6-step implementation toolkit for sites to use. So the first step there, if you can see that, is building partnerships. So that's really through organizing this interorganizational co-leadership team and advisory committee. The second step is understanding communities through a community assessment and environmental scan, and I'll talk a little bit about that. The next step is preparing volunteers through the Nav-CARE volunteer training, visioning and implementing interventions that promote awareness, build knowledge, and provide practical support for older persons living with declining health and their care partners is step 4 on that diagram. And of course, following this, evaluating the interventions and considering the sustainability of these interventions. And you can see the line there through this fishbone diagram that we have sustainability at the tip there. So just a quick note about that piece. when we talk about sustainability, we're really talking about making thoughtful, intentional decisions all along the way, which I think is why this diagram, thank you, Gloria, for doing the diagram, really speaks to this quite nicely. So those decisions that we make along the way really support the long-term success of the project. So in this work, communities are coming together around a shared purpose. And what really determines whether this work can be sustained over time isn't just what we do, it's how we do it. Because of that, sustainability isn't really a single step, though we have it that way currently in our draft toolkit. So it's not a single step that you just check off. It really is staying focused on these pieces throughout the entire implementation process. So next up, I'm going to take you through these steps as I talk about how the CIHR project is unfolding. And then, as mentioned, Gloria will take you through the Health Canada project in a similar manner. So just some of the project details about this project that we call the CCVN, which is the Compassionate Community Volunteer Navigation project. So as mentioned, this is funded by the Canadian Institutes of Health Research, and it builds on the strengths of the two social innovations that we talked about at the beginning of the webinar, and that's volunteer navigation, the program called Nav-CARE, as well as a social mobilization approach called Compassionate Communities. And so the goal of this project is to really create a new model of volunteerism called Compassionate Communities Volunteer Navigation, and we like to call it CCVN because it's a mouthful otherwise. So this involves implementing a compassionate communities approach in 4 rural communities in British Columbia that have an existing Nav-CARE volunteer navigation program. So the CCVN project is being carried out in 2 18-month rounds of implementation. The first round started last April in 2025 and runs until the end of September 2026. So coming up, we're at just over the midway point. And the second round runs from October 26 to April 28, enabling 2 more rural sites to draw on the lessons learned from the first 2 sites. So the first 2 sites we're working with is Columbia Valley and Quadra Island. And as I mentioned, they're now just past the midway mark of their implementation. And so while the data is somewhat limited at this point, I will take you through their first 9 months. So far, as you can see on the screen, they've been forming and engaging a co-leadership and an advisory committee. They have been administering the Compassionate Communities Index Survey. We call that the CCI survey. And this assesses level of readiness and commitment to adopt the 5 ideals of a compassionate community. And I think Kelli was also going to note that in the chat. And the sites are currently in the process of implementing and evaluating 2 interventions each. And so I just want to add here that in addition to the Compassionate Communities Index Survey and specific intervention evaluations, this particular project is collecting some additional data looking at both process and outcomes. And so I'm conducting interviews with co-leads and advisory committee members. There's something called the most significant change technique, and that's to help us learn about the most meaningful changes that have resulted from the CCVN approach. I've been doing network mapping with each co-lead organization, and that maps the number of partnerships as well as the strength of those partnerships as they develop over the project period, and as well as a volunteer navigation reach analysis. So that's just measuring changes in volunteering and the number of clients served over the project period, the 18 months. So in terms of the next slide, building partnerships, first is the co-leadership teams. So the first step in the implementation process is, as I mentioned, building partnerships. Each site was tasked with creating a core leadership team consisting of 2 to 3 people representing different organizations who commit to working together to implement the project work plan. And so that's really getting at that first step, that interorganizational partnership piece. So as mentioned, each primary organization has an existing Nav-CARE program. And as you can see here in the table at the top of the slide, one of those primary organizations is a hospice society, and the other is a nonprofit with a variety of services geared to older persons. In terms of the partner organizations for these 2 sites, they include a community-led death care group of volunteers, as well as a community support services organization that has a variety of programs, including the Better at Home and the Community Connector programs, which for those of you who perhaps are joining us from outside of BC, these are funded programs through the United Way, specifically for older persons. So the responsibilities of the co-leadership team, sorry, Gloria, with support from us, the UBCO team, include creating and leading the advisory committee. They schedule and develop agendas and conduct the advisory committee meetings. They promote the Nav-CARE training. They develop and implement a communication plan to keep organizations and the community informed of what they're doing, as well as the planning and the implementing of the 2 compassionate community volunteer navigation initiatives, and they do that with assistance of the advisory committee. They do the evaluations of the intervention, and they also engage in a bi-weekly community of practice, and there they share ideas and strategies and solutions all along the project. Okay, now the next slide. So a part of the building partnerships, as I mentioned at the beginning, is also putting together advisory committees. And so co-leads were asked to be really intentional about representation, and were encouraged to include persons living with declining health as well as care partners. So each advisory committee has between 15 and 20 members. And as you can see here, the majority of the members represent various community support services. And again, in thinking about the intentionality of this, for example, the Columbia Valley is sort of a 100-kilometer stretch along the highway with communities from Spilamachine to Canal Flats. And so as an example, the co-leadership team was really intentional about ensuring that there was representation from each of those communities on the advisory committee. So that's sort of one example of that intentionality. So the advisory committee's responsibilities was to help the co-leadership team meet the project deliverables. And so that includes attending the regular meetings, whether they be in person or on Zoom, keeping their own organizations informed about what's going on. They participate in the data collection activities with the UBCO team, and that's at 3 time periods over the 18-month implementation process. So we have baseline, midpoint, and endpoint. They also complete the Compassionate Community Index survey, as well as interviews. They also contribute to raising awareness about compassionate community volunteer navigation developments that arise from the project. Often this is done word of mouth, but again, going back to their own organizations and really being those super connectors, as Dr. Xiao, if you've heard that term before, really being the super connectors on this work. And they provide input into the compassionate community volunteer navigation interventions that are a part of the project work plan that we'll talk about in a little bit. So the next step is putting this work into action. And so they do that by doing a community assessment. So next slide, Gloria, please. So the community assessment for these projects, we are using a slightly adapted version of the Compassionate Community Index survey. And this survey you'll find in the Compassionate Community Toolkit from the BC Centre for Palliative Care. The purpose of this survey is to help understand where a community is starting from. How ready is it? What's already happening? How committed people are to becoming a more compassionate community? And so the results give the community a really clear picture of its strengths, as well as areas where there might be opportunities to grow. That information then helps guide the next steps, as well as those practical actions. So over time, the survey can also be used as a benchmark, so communities can see how their compassionate community initiatives are evolving and making a difference. And so the 5 ideals of a compassionate community, as you will see on the slide, are awareness and advocacy, attitudes and commitment, leadership and capacity, networks and connections, as well as opportunities and recognition. So each ideal has 5 related questions in the index survey that ask participants to rate how they feel about where their community really currently is on the journey of becoming a compassionate community. And so we have it on a 6-point scale ranging from don't know, we're just getting started, all the way to we're there. So it essentially takes a snapshot using perceptions of community stakeholders. And in the case of this particular project, it's the advisory committee members. Again, this next slide might be challenging for you to read, but this is some of the survey results we got from the baseline. Again, as I just mentioned, we asked sites to administer this survey with their advisory committees. So 39 people for the CIHR project from the 2 communities completed the survey. For 3 of the ideals, if you can see they're highlighted in yellow, most responses are clustered around the first 3 categories of not yet started, just started, and on the road. While for the ideal of leadership and capacity, that's right in the middle of the slide, the advisory boards perceive that they were slightly further along in their journey in regards to that ideal. So the results of the survey served as a starting point for discussion around aspects and characteristics of the community that could be strengthened by addressing them, as well as what initiatives could be employed to do so. At the end of the CCI survey, folks are also asked a few open-ended questions. So one is 3 words that describe my community. And so as illustrated here, quite a variety of words used to describe their community: independent, quirky, seasonal, proud, doers, just to name a few. And so we'll address this later at the end of the presentation when Gloria and I talk about the importance of really understanding the culture of the community as one of the lessons learned. So the next step in this initiative is preparing volunteers. So it's important to acknowledge first that there are many volunteer training programs across different organizations. At the same time, we also know that in practice, volunteers can often receive very limited training besides the initial orientation that organizations provide. So that's why in step 3 of the implementation toolkit, we really emphasize the importance of structured, intentional training for volunteers who are doing this kind of work. Our research shows that good preparation matters. It helps volunteers offer compassionate, confident support, respond well to people's needs, and avoid some of the common missteps that can happen along the way. So for the CCVN project, we're asking all volunteers to complete the Nav-CARE volunteer training as a baseline. That said, completing the training doesn't mean that volunteers have to take on the traditional Nav-CARE role of working with one-to-one clients over time. There are a variety of different roles within this project that volunteers can take on. So that might be the advisory committee as a member of that committee, helping with an event, facilitating a workshop or an art class, delivering meals to people who are feeling isolated as another example. And so in the next couple of slides, you'll see even more examples of these various volunteer roles throughout the CCVN project, and also how the Nav-CARE training helps support volunteers in delivering meaningful community-led initiatives. So for those on the call today who perhaps aren't familiar with the Nav-CARE program, as well as the Nav-CARE volunteer training, the training consists of 7 modules. So those include introduction to the volunteer role, assessing quality of life concerns, creating community connections, advocating with persons and family, promoting active engagement, facilitating virtual engagement, and our latest module, which is supporting persons living with dementia. So the next step in the implementation plan is visioning and implementing a plan. So after step 1, which is the building of partnerships, step 2 is the community assessment, step 3, the volunteer navigation training. The next phase is really about visioning and putting that plan into action. So for visioning for the CCVN project, each site is ultimately responsible for delivering 2, we're calling them interventions. They're more like initiatives from the community perspective. So 2 interventions over the 18-month project period. So ideally, one of those interventions will focus on raising awareness and education in the community, and the other focuses on providing practical hands-on support for people living with declining health, as well as their care partners. So the results of the Compassionate Community Index survey that I shared earlier play an important role here. So the results from that survey really helped the co-leads and the advisory committee members identify where their community was already strong, where there were opportunities to grow. And so from there, taking that information to really brainstorm the types of events, activities, or programs that they wanted to bring forward as part of the CIHR grant. And so, as I mentioned earlier, the sites were involved in a community of practice. And so this was one of the times where they shared ideas about, how will they decide, how will they pick just 2, because for one of the one of the sites, there were 10 ideas pitched. And so all really fabulous ideas, of course. And so, you know, they came up with even a rating scale in terms of how to choose the ones that that most spoke to everyone on the advisory committee. So was it volunteer driven was one of the rating characteristics. Is it doable within the project time? Because of course there's timelines to consider with this project. Is there a possibility that it can be sustained after the project is finished? And does it fit into one of those intervention categories? So either education, awareness, or practical supports. And so in terms of the implementing across the 2 sites, so of course there are 4 interventions in total, as each are responsible for 2. So one of the ones chosen builds on an existing program, and 3 are completely new initiatives. And so once advisory committees selected their top priorities, smaller subcommittees were formed from the advisory committee to really support the heavy lifting with the co-leads in terms of the implementation. From there, each site developed a work plan, a budget, a logic model for each intervention. And of course, throughout this process, the UBCO research team worked closely with the sites to develop all of those pieces, as well as evaluation tools, so that they could meaningfully assess each intervention as it rolled out. So the next couple of slides are just a little description of the interventions that are currently happening. And so this first slide is knitting connections on Quadra Island. And I use knitting purposefully here, talking to one of the advisory committee members in the baseline and the midpoint interview, when asking about sort of what a compassionate community meant to her. Her description was, it was really about knitting all of the pieces that are already happening in community together. That for her was what the compassionate community framework and movement really allowed them to do. And so I really loved that analogy. And so the 2 interventions on Quadra, so the first one here is simple sharings. So this is an intergenerational program whereby children at the local childcare center and seniors from the seniors housing complex get together as part of a regular group, and the seniors plan a variety of activities. So far, activities have included playing instruments and games like charades. They've done art projects. They've baked bread, they've decorated cookies. So this gives the 2 generations the opportunity to learn from one another and to develop friendships and positive perspectives. So this intervention started in November. And so, yeah, and they're learning as they go. There are always hiccups, whether it's illness or weather, things happen. And so, but overall, the feedback has been really, really positive thus far. And the next intervention that Quadra is just about to implement is called the Compassionate Neighborhoods Program. So this initiative is described by the co-leads, and I had to use this is a quote because it's so well framed. So it's a warm-hearted, community-driven volunteer project dedicated to providing personal and practical support to any neighbor facing challenges such as isolation, illness, or difficulties managing their homes and properties. So this intervention actually follows the service model of a different program called the Neighborhood Emergency Preparedness Program. And so this service model has the Quadra neighborhoods all mapped out. And so there's an emergency preparedness person who's associated with each of those neighborhoods who provide support during disaster-related events. And so in the case of the Compassionate Neighborhoods program, a similar approach is being taken in terms of sort of having the neighborhoods on Quadra all mapped out. And 2 to 3 advocates who are trained in Nav-CARE will be assigned to each neighborhood to assist community members with those non-disaster related concerns, whether that's meal delivery when someone's away at the hospital, connections to service, transportation needs, getting to appointments, as well as home maintenance. And so in addition to trained volunteer advocates, the community is also recruiting general volunteers from each neighborhood to help lend their time and expertise in terms of helping their neighbors. So whether that be chopping firewood or helping with yard maintenance. So those are the 2 interventions on Quadra. Next are the 2 interventions happening in Columbia Valley. We're calling this Nurturing Relationships in the Columbia Valley. So the first program is called We-CARE. So we, and then the CARE is the same acronym as Nav-CARE. So this really is an augmentation of the Nav-CARE program, whereby persons or care partners are able to connect with trained volunteer navigators to access timely emotional support, as well as those community connections right after a life-changing diagnosis. So in the planning of this new program, information was gathered from the medical community, as well as other sources about current supports or lack thereof. And then based on all of that feedback received, the program was designed and an information card, I'm not sure if you can read it well on that slide, was developed for patients and families. And so that card was then distributed to various sort of doctor clinics and labs, pharmacies, for example. And they did community presentations up and down the Columbia Valley to really promote the program. And they also gave presentations to the municipal councils as well. And so the next program that they are planning in the spring, it hasn't happened yet, is an intergenerational program as well, similar to Quadras in that respect. So they have a beautiful healing gardens next to Columbia House, which is Invermere's long-term care home that often doesn't get used. And so this garden is designed with older persons in mind, so graded sidewalks, railings, and so it really provides a warm, therapeutic, compassionate space to explore and relax. And so they're really trying to find ways to tap into that and use that space well. And so, so current ideas are to perhaps connect with youth who have to do volunteer hours as part of their capstone project. And so to really kind of generate those cross-sectional connections through shared activities. They've got a talk and walk idea planned. It could be memory cafes, and so they're just really gathering ideas now to hopefully launch that in the spring. And so in addition to the 4 interventions, both sites have been really actively engaging with community around this work, and it's quite incredible what they've been accomplishing. It really is. And so you can see the variety of engagement activities there on the screen. So, for example, the radio print media, so far, 21 newspaper articles or ads have been put into print media between the 2 sites. One of the sites had an interview with CBC Kelowna to help raise awareness about their particular intervention. Social media has played a huge role. So this includes a compassionate community website, online newsletter, email campaigns, and of course the regular Facebook and Instagram posts. And so sometimes some of those posts can get up to 5,000 views. So that's really doing an incredible job of bringing awareness around the project, as well as things like volunteer recruitment. On the ground, more than 2,000 pamphlets and posters, rack cards and surveys have been distributed. As mentioned, they have been shared in medical offices, labs, pharmacies, community events and meetings. So really reaching residents, patients, key stakeholders, as well as the general public. Through public presentations, workshops, training sessions, town halls, sites have already connected with over 1,200 people. And finally, there's been a lot of targeted relationship building happening as well. So that happened when they were forming the advisory committee. So really strengthening those partnerships, and as well as building partnerships to plan and develop the interventions. And so now I will hand it over to Gloria, who will talk about the Health Canada project.
Thank you so much, Kelli, for that. I really appreciate that. I'm sorry for advancing your slides a little too quickly. I didn't have your notes in front of me.
Okay, thank you.
Sorry about that. So, oops, let's go there. So as mentioned, I'm leading a project that's supported by a contribution from Health Canada. And this project builds on the strength of Nav-CARE compassionate communities and the dementia inclusive or the dementia friendly community movement. And with the intention to reduce stigma, raise awareness, and offering empowering supports for people living with dementia and their care partners. So this project is being carried out in 2 15-month rounds implementation in 6 sites from 4 provinces across Canada. 3 sites started in October 2024, and the other 3 sites started in January 2025. So this means that pretty much everybody's coming near to the finish line. There's one site that started a little bit later than the rest due to some bureaucracy things with the UBC and the and the organization. So they're a little bit delayed. But we follow a very similar process as what Kelli described for the CIHR project. And I'll take you through how the project unfolded in terms of its organizational partnerships, the community assessment, and the kinds of interventions implemented. And then we'll talk about lessons learned as well. So as Kelli mentioned, the first step in the whole process is about building partnerships. And as you can see at the top table, this table identifies the primary organization who's the primary responsible party in meeting the project deliverables. And so as you can see, there are 3 hospice societies, 2 nonprofits with a variety of services geared to older persons, and 1 health authority. Each of these sites are tasked with creating a co-leadership team consisting of 2 to 3 persons representing 2 to 3 different organizations. And as you can see from the bottom table, these partner organizations include primary care, community support services, United Way's Better at Home and Community Connector program, the Alzheimer's Society, a municipality, and a faith-based organization. Like Kelli's project, the leadership team was tasked to convene an advisory committee that had between 15 to 20 members. They're asked to be really intentional about representation and were strongly encouraged to include persons living with dementia as well as care partners. And as you can see, and I love this so much, the majority of membership represents persons living with dementia and care partners. So sites were really, really committed to having representation from this population, although it was not easy due to the logistics of bringing together, sorry, bringing together people with diverse needs and diverse schedules. While meeting over Zoom enabled some flexibility, there were times when people with dementia or care partners simply could not attend those meetings. And so to that end, a couple of sites met with folks individually so that they would be kept in the loop and have the opportunity to voice their perspective about the things that are going on, even though it may not have been at the official meeting. And I really think that this is exemplary of what compassionate, inclusive communities are. So they're walking the talk instead of talking the talk. So that's really exciting to see. So we also did the community assessment, the same kind of survey that Kelli mentioned, but we did modify this to reflect persons living with dementia and care partners. And that's essentially, that was just kind of tweaking some of the language and the words used to make it very specific to that population. So this survey was administered with the advisory committee as well. Though one of our sites decided to survey or try to survey their entire community to help develop their strategic plan for the next 5 years. So 129 people from the 6 communities completed the survey. For all ideals, hopefully you can see this, it's boxed in yellow. The responses are clustered around that first 3 categories of the not yet started, just started, and on the road. The results of the survey served as a starting point for discussion around aspects and characteristics of the community that could be strengthened by addressing them and what initiatives could be employed to do so. But I do want to draw your attention to the ideal attitudes and commitments. You can see here that the highest portion of responses are located in the not yet started, just started categories. I'm going to circle back to that in a couple slides, but I just want you to tuck that away in your minds. Similar to Kelli's presentation, at the end of the survey, folks are asked to name the 3 words that describe their community. And as illustrated here, people perceive a wide array of characteristics when describing their community. Some of them are really positive, like active, accepting, and adaptable, but some are not. Some are not so positive, like blinders on or cliquey. And as Kelli mentioned, we're going to be talking about the idea of culture and the importance of understanding culture of the community as one of our lessons learned. Much like Kelly's project, we also focused on volunteer training, and all I want to say here is that the Nav-CARE training does include that dementia module that's based on some of the research that Dr. Barb Pesset and Maddie Huggins, Dr. Madison Huggins did a few years ago, and so that forms part of the Nav-CARE training, and the expectation was that the training across partner organizations happened with that module as well. I also won't speak too much about the visioning and implementing a plan, as I want to focus more on the initiatives that have happened or are happening. But I do want to highlight the creativity and passion that came forth with visioning a plan. You heard from Kelli that sometimes you just really needed to rein in the sites because they had so many creative ideas. And just thousands of ideas, like we could do this and we could do that. And so you kind of had to pull them back, thinking about the implementation period, the amount of time that they had and their budget. Some of these initiatives that they wanted to do were really significant changes, for example, to the built environment, like fixing sidewalks and walk signals to cross the street. And so some things were not quite doable, but they were important nonetheless to discuss in those advisory committees, as some of the representation there is from persons sitting on town council, for example. So yeah. So amongst all of the things that they were doing, there was a tremendous commitment to raising awareness in the community, not just in terms of what they were doing vis-a-vis this project, but generally raising awareness about dementia and the different services available in the community to support persons with dementia and care partners. And this really harkens back to the survey result with attitudes and commitment. That posed a real opportunity for change. So that ideal asked questions about stigma and taboos. We know that there is quite an issue with dementia stigma. That ideal asks questions about commitment from the public and municipality just to intentionally support persons living with dementia and care partners, and whether there is an intersectorial and community sort of engagement to develop community-based solutions. So they used that ideal of attitudes and commitment and really leveraged that, not just started or were hardly getting going, and really put a lot of attention onto that. And so how did they do this? Very much like what Kelli talked about is that intentional engagement with the community. And there's been a real strong uptake through this, this community engagement sort of tsunami. But some of the sites were just extraordinary efforts putting in to connecting with the people in their community. I'm not going to go through this in detail. They're the same categories that Kelli identified, but yeah, they put a lot of effort, and they're still putting a lot of effort. They've got their names on agendas everywhere, it feels like. So I just think about that kind of effort and the how they really made a difference just by putting themselves out there like that. So now I'm going to take you through the array of interventions that organizations undertook. I can't speak to all of them, as the sites have really truly gone above and beyond what the expectation was. And since we're talking about organizations from across Canada, I'm going to move us from west to east. So starting in the Lower Mainland, the Brella Society, along with our partner, the Progressive Intercultural Community Service Society, have started an array of specific services for persons living with dementia and care partners, all of which will be sustained in some capacity. Of importance is the Sanj support. This is a dementia support group for the South Asian community. And this group is a real big deal for this organization and for that community. It's the first group of its kind in that area. It's very well attended and is making a tremendous impact in terms of dispelling some of the taboos and stigma around dementia within that community. We know that in this community, persons are not diagnosed with dementia really like early on in the dementia process. So this hopefully will help with that, getting an earlier diagnosis of dementia. The second part that I wanted to raise with this partnership is that Brella has also integrated their Community Connectors program and the Nav-CARE program to form a cohesive support system across their programs in their organization, and they're also supporting PICs to do that as well. And this has been really trying to animate a more smooth and seamless referral pathway between the different programs that tap into the Community Connectors program and to the Nav-CARE program. We're going to then move to Prince George, and the Hospice Society there, along with the Prince George Council of Seniors, developed this really cool program. It's a comprehensive program called Connecting Minds Through Compassionate Hearts. The program is rooted in community care and human connection with persons living with early stages of dementia, so that they have opportunity to be seen and heard in the community. The program matches people with volunteers, and as a group, they go out to into the community to participate in events and other leisure activities that align with their shared passions. Alongside, caregivers are participating in support groups and make connections in community with each other. If you want to learn more about this program, the BC Centre for Palliative Care are hosting a ECHO session, and Prince George Palliative Care Society will be presenting on this program. And Kelli is going to pop something in the chat, a link to the registration for that. So then we're going to go to the Kootenays and in Trail, BC. And here the co-leadership team organized a large community raising event called An Evening to Remember, with the intention to dispel some myths about dementia, educate the community about dementia, and help people learn about the resources available in the community for persons with dementia and their care partners. They also developed a form entitled What I Need to Thrive. This built upon an idea from one of the care partners on the advisory committee. The purpose of the form is to communicate to healthcare providers the needs of persons living with dementia, their preferences, and how to work with responsive behaviors if these things surfaced. This form was shared widely with healthcare providers and the persons living with dementia and care partners, and early feedback is really showing that it's quite useful to both groups. We're now moving to Northern Alberta. Let's see, where are we? Here we are. So up in Northern Alberta, compassion and inclusion undergirds all that age-friendly Cold Lake does. So they're reconceptualizing their array of programs through the lens of compassion and inclusion. For example, thinking about their Men's Shed program and thinking about how that program can be more dementia inclusive. So making the spaces safer, having persons living with dementia being paired with volunteers so that they can access that space and so forth. They're also adding new dementia-specific programs to what they offer to the community and beyond just the age-friendly Cold Lake community itself. So the team has developed several dementia support programs called Hope Harbor, caregiver support groups, grief bereavement cafes, a program in long-term care called A Walk Down Memory Lane, which is an intergenerational reminiscence and storytelling program. And they've also developed a caregiver toolkit. Now we're going to skip over the Prairie provinces and go to Ontario. So the folks out on the Bruce Peninsula, this is Bruce Peninsula Hospice, partnered with the Alzheimer's Society and the Home and Support Community Services Grey Bruce to focus their energy on educating businesses to better support people living with dementia and to engage the public to raise awareness and create space for people with dementia to talk about their experiences. Remembering Wyerton was an event where they celebrated businesses in the community becoming dementia friendly. So the businesses were trained in the Alzheimer's Society dementia friendly curriculum. Their Food for Thought series was a way to engage with the public in places where the public hung out. In grocery stores, owners of grocery stores were really eager to have the team in their space to engage with the public and with their staff to learn more about dementia, inclusion, and the practical supports available to them. Their motto, local people helping local people, compelled the public to ask questions about how they themselves can be more neighborly and supportive in their networks. Then finally, we're going to Newfoundland, and along with that, so this is Newfoundland Health, along with Primary Care Network and the Alzheimer's Society, this team is developing a standardized and clear pathway in the electronic health records for family doctors to be able to refer to community services such as the Alzheimer's Society and the Nav-CARE team. The team is also working with family doctors to identify the best kind of information to give to patients and care partners at specific specific points along the dementia journey, and developing educational materials that can be deployed to family practice waiting rooms. So this is a very quick overview of the different things that the organizations have done. And now we're just gonna, I'm looking at the time, sorry, Kelly. Kelly is gonna join me, and we're gonna shift to talking about some of the lessons learned. So one of the first things we learned relates to grounding interventions in a shared understanding of compassionate communities. Kelly, how did you see this emerge in your project?
You know, I think what really came out is when we think about compassionate communities, while the recipients are older persons living with declining health and or dementia, as well as care partners, interventions really impact everyone. So getting back to Quadra Island simple sharings, now I'm gonna cough, sorry. You know, while the intervention was designed in terms of supporting folks who were living in that seniors housing. Many people who retire in Quadra don't necessarily live there with grandchildren. They've moved there to retire at that stage, and so the idea was to bring children in and provide them with that energy and so what's happening though are the children are really getting a lot out of the compassionate community intervention as well. And so a big impetus was, you know, when you're building compassion, it's starting at that young age. And so the children are really seeing the older persons for who they are and their wisdom and skills. And you know, in terms of the feedback they're already generating, it's the children are amazed at how much fun they are, for instance. And so the impact is far and wide, I guess, is one of the big lessons learned so far.
Sure. Thank you. And I think that's very similar for the CDIC project, where it is, when you talk about inclusion, it's very clear from these communities that inclusion means everybody, and you need to make everything inclusive. Not just for persons with dementia. So that means the spaces need to be welcoming, safe, and respectful for everybody. And then to build a compassionate community then is about raising that awareness about the lived experience of something like dementia and being intentional about making those connections where with those who might not otherwise be connected. That's one of the learnings from our project. So the next thing we wanted to talk about was relates to understanding of community and culture. And we shared those word clouds that illustrated the 3 words people use to describe their community. These illustrate how advisory committees perceived their communities and how this perception subsequently influenced the kinds of interventions and activities they undertook. So Kelly, can you talk about how this kind of unfolded in your project?
Yeah, I mean, I think again, getting back to that question on the Compassionate Community Index survey was incredibly meaningful for advisory committees to really unpack those words. And when they were thinking about designing those interventions, it was being mindful of those cultural aspects. And so, you know, both sites that we're working with for the CIHR grant in round 1 are very large tourism areas. And so with that comes benefits, but certainly challenges in terms of who's there and when. And so neighborhoods are a little different when a lot of the homes are only occupied on a part-time basis. And so how do you build community when your neighbors maybe are not always there, as an example? It's just those seasonal changes and shifts in community culture. For example, on Quadra, summers are not a great time to run programming, because again, lots of tourists are there, and the folks who live there are elsewhere. And just other geographical considerations, as I've mentioned, with the Columbia Valley, with that 100-kilometer spread. And so how do you engage? Every community has its own culture. And so being very mindful about how things work in those communities. And then, yeah, one of the pieces that came up with the Quadra are that folks are quite independent. And so they move there. Moving to an island draws a certain kind of person. And so how do you respect that independence, but still offer programming that provides support? And so that compassionate neighborhoods really grew out of that. People have a big desire to get to know their neighborhoods and to be social in those kinds of environments, but perhaps aren't quite yet ready for that sort of more traditional support program. And so there are just a few examples there.
Sure. Thank you. And I'm going to say ditto. That is unfolds in very similar ways with in the CDIC project. And I'm just bearing in mind the time. So I'm just going to move on to our last lesson learned. So the third thing was that this is a big one. It's about leveraging interorganizational partnerships to build community capacity. And Kelli, I will turn it to you again, and then I won't really chime in.
Unless you have something different to say, I'll be fast.
Okay.
I'm going to just start by saying, these communities have a lot of experience in interorganizational partnerships. And, I'm working with rural communities in particular where there is really, not a lot of formal services. And so folks have had to organize themselves to provide a lot of support services. And so this is not new to them. And so, getting back to that analogy around knitting things together, both communities really saw this kind of approach as the ability to give them a framework in which to do the work that many of them are already doing. And so, it just kind of brings everyone alongside, and so that they are leveraging those partnerships and really kind of increasing their impact.
Wonderful. Thank you for that. And thank you, everybody. We are at the end of our presentation, and Paula and Kelli Ashford has come back on, and so we'll let you two kind of facilitate the questions. There we go.
Sure. Well, I'm not sure how much time we've got for questions. There's only a couple of minutes left. So I was just going to say, I've popped the Nav-CARE email address in the chat. So if you do have any questions arising from the presentation, please do drop us an email and we'd be more than happy to answer any of those questions. Paula, I'm not sure if we've got time for one, or do you want to just close and leave it there?
I think, let's see. I think we might close it if that's okay, because we're nearing so close to the end. So I really appreciate you all presenting today, and your willingness to take questions by email. That's fantastic. Oh, such interesting, deep work. I know an hour is a short time to really describe how layered and how much work has gone into this important community building and capacity building exercises that you've engaged in. So I really appreciate it. I'd like to thank Gloria and Kelli for your presentation on becoming a compassionate community, lessons learned from Canadian communities. And thank you, Kelli and Jaquetta, and for your support in this presentation, and everyone for attending today's webinar. We encourage you to attend other events scheduled for Embrace Aging Month. Please visit our website, OkanaganEmbraceAging.com, for all the events and registration. We do have some more really interesting events going on in the next few days. I encourage you to check out the website. And there are also recordings that will be available. And there'll be an email coming out for an evaluation, and it will include a recording when we're able. And we look forward to growing this event in the future. If you have any feedback, we'd welcome it to make this always better. And thank you for your time. We appreciate you attending and participating in this event.